Welcome, everyone. We'll get started in just a moment. Good afternoon, everyone, or good morning, depending on your time zone. I'd like to welcome you to Intact's System of Care Essentials Learning Series, Expanding Your Table, Building Bridges to Effective Engagement of Underrepresented Groups in Your System of Care. We are very excited about the panel that has gathered with all of you today and look forward to a very rich discussion. So as folks are joining in, I think there's a few people still waiting to be admitted into the waiting room, but as we are gathering, please feel free to drop into the chat your name and where you are, the focus of your system of care, whatever you would like to share with us today. And you'll have an opportunity in just a few minutes in a breakout group to chat a little further about who you are and what you're working on. But for right now, if you wouldn't mind just introducing yourself in the chat, we'd love to know who you are, and we'll go ahead and get started. Before I jump here, I'll introduce myself. My name is Suki Steckel, and I'm with the Partnership for System Transformation team, and I will be moderating the session today along with Pamela Trivedi and Victoria Eckert. So this is just a brief disclaimer about our work here with SAMHSA. Intact is funded through a grant with SAMHSA, and this is just a notice that explains that the voices and opinions on the webinar today are that of the presenters and not of SAMHSA. For those of you who are not familiar with Intact, you can see we are a group of multidisciplinary teams, and we work in collaboration with the folks here and are excited to bring you all of the offerings that Intact has. And you can contact us on our website if you would like to submit an individual TA request or find out more about the training and technical assistance that we offer. Our goal is that all children, youth, young adults, and families with emotional or behavioral health needs can access evidence-based treatment and practice-based evidence, supports, and recovery services in a well-coordinated system of care. So as I mentioned, the moderators today are myself, Victoria Eckert, and Pamela Trivedi. And we have 6 panelists for you today, and we're very excited to have them introduce themselves when we get to that portion. But those folks are David Armstrong, Rose Daniels, Tyler Goddard, Manny Hernandez, Byron McClure, and Sarah Miller. And as I said, they will introduce themselves here in just a few minutes. So we're going to start off our conversation today with the question, who is not at your system of care table? And the reason that we want you to think about this is because for those of us who've been working in and around systems of care, we know that it is so critical if we're going to advance health equity related to children's mental health and how we serve and support families and young people, that it really takes everyone in our community. And sometimes when we are working in systems across education or child welfare, juvenile justice, community-based services, mental health, of course, that sometimes we can get overly focused in the more traditional systems and are not doing as good of a job engaging the folks who are out there in the community, really sustaining families before they might come in contact with a more formal system of care. And it's really, really important that in our work together that we are focused on all of those community service organizations across our across our communities to make sure that we're really engaging voices at every level, because those are the folks who are really going to be sustaining our system of care over time. And we wanted to take an opportunity to engage in a conversation today around how to reach out and work with, and what are some strategies or tips for engaging groups of constituencies that aren't always the first folks that we really think of when we want to bring people to our system of care table, whether that's for program design, evaluation, implementation, all aspects of our system of care. We want to make sure that we're engaging all of those who are out there in the community really doing the work. And so we wanted to take an opportunity, and we will do breakout rooms for about 10 minutes. And if you can think about, as you go into those groups or as you go into those rooms, who is not at your system of care table that you would like to engage. And we invite you to center that, that group or that constituency throughout the duration of our time together on the webinar. So Joanne, if you could go ahead and put us in breakout rooms, we will engage in those discussions together. Welcome back to the main room, everyone. I hope you all got to hear from your friends and colleagues in the session. So I'm going to go ahead and turn it over to our fellow moderator, Pamela Trivedi with Georgetown University, who is also on the Partnership for System Transformation team. And before I do that, I'm just going to let you know, I'm going to put my email in the chat. So please do feel free to reach out if you have any follow-up questions or need anything else from INTAC in the future. Thank you, Pam.
Thanks so much, Suki. Yeah, I mean, I was so pleased just now in this small opportunity we had in the breakout room to just hear more about the folks who are on the in our webinar today. And, you know, we're so excited to hear from our panelists now. They bring such kind of deep lenses that are not often considered. So we're really excited to hear more from them. I'm going to go ahead and without further ado, just ask folks to tell us, ask folks on our panel here to tell us a little bit about how you got to where you are. So I'm going to go ahead and kick off our panel, starting with Tyler. Can you go ahead and tell us a little bit about yourself and how you got to where you are, please?
I sure can. I apologize. I decided to have some yard work done right outside my office door. But yeah, Tyler Goddard. I'm the health director for 4 Points Health. 4 Points Health is owned and operated by the Paiute Indian Tribe of Utah. We operate 5 community health centers throughout Southwest and Central Utah. I've been working with the tribe for 11 years, social worker and behavioral health background, lots of years of experience there, and working both the state and privately, and then now with the tribe. And just, I love being able to work with the tribal people and tribal community that I'm honored to work with. The tribe has an amazing story, and without going into too much detail, had went through kind of the termination period back in the 1950s, and resulting deplorable health conditions, social conditions, and kind of on the brink of extinction. And then we're able to be restored in the 1980s and move into an area where, through partnerships and coming together with community, with state partners and federal partners, to where they're providing their own social services programs, health programs, and now communities around the tribal communities are coming to the tribe for healthcare and other services. And it's just amazing that we're able to do that. And of course, it takes a village to raise our children and families. And I think the programs that I work with, we're building and rebuilding the village. So that's how I came to be where I'm at.
Really well said, and really quite an amazing sort of transformation from, because of a lot of harm, to say the least, almost extinction of the indigenous communities that you work with, to them being the center of social services that extend beyond the indigenous communities to the larger sort of local area. So that's really an amazing story. Tyler, I want to go ahead and transition to Sarah. Sarah, can you tell us a little bit about who you are and how you got to this work, please?
Sure. Hi, everybody. I'm Sarah, and I am a certified recovery peer specialist, which means I'm an individual with lived experience and with mental health challenges. Also for family members, because I have children who have experienced mental health challenges as well. And I'd say that really kind of led me on a path that brought me to where I am now as a family peer services director with NAMI, Sarasota and Manatee counties in Florida. NAMI is the National Alliance on Mental Illness, and Sarasota Manatee is our local chapter here. But basically, I'd say my path with NAMI was more of a consumer at first, because they offer a lot of different supports and educations for individuals with mental health experience to learn more about how to stay in recovery. And a lot of what I learned there through the support groups and the education just ignited my passion. And I realized I'm an advocate and I want to work in this field. And I was fortunate to get a position on a local system of care grant, which exposed me to many valuable and transformative, I'd have to say, values that really helped launch my family's recovery even more. So now I take that back to my position today and can work with other families, individuals, and youth who are seeking that same support and connection to what can help.
Thanks so much, Sarah. And I really admire how, sort of from the ground of your personal experience and the experience of your family members, you're able to leverage that to share resources about recovery through your work. It's really inspiring. I'm going to ask David to go ahead, since I feel like David's story is related to Sarah's. David, will you go ahead and let us know how you came to this work and who you are?
Thanks, Pamela. I appreciate it. Hi, everyone. I was kind of forced into this journey about 12 years ago. My grandson started having some serious challenges in school, fighting, misbehaving, disrespectful for his classmates and teachers, getting suspended all the time. I was at the school like 3 or 4 times a week. I mean, I would leave the school and they'll call me back, and, because for some reason, the school didn't have too much of a de-escalating skills, when it comes to special needs children and stuff. So unfortunately, around that same time, his mother, my daughter, passed away. So I became my grandson's legal guardian and stuff. And I was totally lost, had no idea what to do to give him the help. I guess the school system was helping him as much as they could, but they wasn't really offering me anything for him to reach his fullest potential. So I had to learn how to navigate the system of care. And it was somewhat complicated in the state of New Jersey. But what I found out along the way is that it wasn't father friendly. I mean, I appreciate everyone that's in that space. I guess it's about 95% women, and they were used to dealing with other women because they didn't really understand fathers were not just protectors and providers, but we were also nurturers. They were also, thought they all came from the moms. But now, today, more fathers are staying at home and the wives are working, and more fathers are running the household. So that's been my platform for a while, to make sure to let them know. I could be wrong, but as far as I know, father's been part of this family process for a very long time. Thank you, Pam.
David, I always really appreciate hearing about that important lens you bring as a father and grandfather who was a primary caregiver of a kiddo with behavioral health issues and learning issues, who's also sort of recovering from a lot, and how you advocated for your grandson, and sort of kind of took that position of advocacy and turned it into a way to support many more dads and families. I'm going to go ahead and ask, since David's story focused on experiences in schools, I'm going to go ahead and ask my good colleague Byron to talk about how he came to this work. Go ahead, Byron.
Yeah, thank you so much, Pam. And David, hearing that really resonates with me as you share that story, and how personal it is, Sarah, your personal story. And for me, I wanted to be a person who probably looks like your grandson inside of schools, advocating for youth who look like me. And I thought that was important. And I'm a school psychologist by training, practice inside of a school setting for the better part of a decade, went on to redesign the school, went on to create my own social emotional learning platform. But bigger than all those things, just being a person who can support families to navigate that process has been something that has been very important to me. Being able to advocate for policies, being able to bring people like your grandson to the table to share his experience so that he can advocate for himself, there's power in that. And I don't want to diminish what I've done, but to me, it's simple. And that's understanding what these needs of people are, understanding it deeply, feeling it, and then doing everything in my power to meet those needs. And that's what I've been about. And I'll stop there because I know it's a number of other panelists, but man, y'all stories are really resonating with me. So.
Byron, that was really just so beautifully said, understanding what the needs of people are. And then I'm going to mess this up, but you also said something, figuring out how to engage them to advocate for themselves. And I do think you're being very modest when you say that what I did was simple, because that's really complex and really impressive. And I feel like Manny's work with youth is very much connected to the work that you've done, the great, tremendous work that you've done in schools and with school leaders. Byron, go ahead, Manny, please tell us how you got here.
I'm gonna keep following the trend. I just want to say, Byron, your role is so important. It's not a small work. I could really use somebody like that when I was in high school growing up, because I was like David's grandson, just getting into trouble, getting into fights, some physical altercations that like led to like hospital visits. And it was tough, and it was so much trauma that I ended up developing like schizophrenia and bipolar because of it. And now like I have no idea how to manage this. And luckily I had my mom who was there, and she was kind of like guiding me through each step of the process. Like, no, you got to take your meds. No, we're gonna go see your psychiatrist today, and just making sure that I was on top of my stuff. And luckily, because of her and other family members, I was able to like graduate from college. But I gotta say, graduating from college was the hardest thing I ever had to do. It was easier for me to be out in the street doing God knows what than it was for me to be in school. And that shouldn't be like that. That's messed up. It's easier for kids to fail than it is for them to try to get a good life for themselves. And that's a failure that the system it needs correcting. But yeah, so anyways, what I like to do, I like to bring voices to the table. I know young adults that like, oftentimes get looked over, don't get seen, don't get the attention, their potential is not viewed. So let's bring that potential to the table and let's focus on the positive. What are you good at? What can we help you with? What can we make? What is the next step for you? And just focusing on that, because too many people want to focus on the negative.
Absolutely. And I'm right. I mean, just this little slice of our panel here just shows the way, like in different sectors, all of our work is interconnected in the way people are really starting from the ground of our own experience in systems. Sarah's story was kind of really affirming. I'm sure there are parts that were also super hard that we'll talk about as this panel unfolds, but just those of us who had a negative experience in systems and saw a need and just took that and ran with it in ways that were just amazing. let's go ahead. Thank you all so much for sharing those pieces of your stories. Really amazing and inspiring. I just wanted to note for the folks that are logged into this webinar, please feel free to chat in your questions at any time during our presentation, and we'll go ahead and we'll either ask you to come off mute or we'll weave that into the panel as we ask a couple of other questions here. So let's go ahead and move on to one of our other questions. I actually was really inspired by what Manny just said about not focusing on the negative all the time and figuring out how to focus on the positive. And I know Byron has some great words to share about that. Can you say a few words, Byron, about sort of strengths-based approaches?
Absolutely, and it's piggybacking off what Manny just alluded to, right? So often, especially what I've seen in the education space is, and I don't think it's any fault of any particular person or groups of individuals or teachers or mental health who work inside of the schools. Oftentimes it's a result of training, it's a result of the approach. And that approach has been to glorify and to be very skilled at identifying the worst in people. And as a psychologist, a big component of psychologists is identifying the absolute worst in people and using a set of tools such as psychological assessments, evaluation tools, reports, behavior screeners to identify the worst in people. And as a psychologist, that never sat right with me. We would come to these tables and have decisions and really just glorify the worst in people. And parents are sitting there, students are sitting there, and they're just hearing negative, 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 non-stop. And then what happens, the families, those students, over time, you hear that long enough, you start to believe that's who I am. And for me, I said, this can't be life. This can't be true. Our students are more than that. People are more than that. And so we have to shift that mindset, that approach from identifying what's wrong with people to looking at what's strong in people and using tools to identify what are your strengths. How can we leverage that to bring out the very best, to connect you with the network of people so that we can leverage those strengths and use social capital so that you can get those things that you might need. And that's been a big emphasis of my work and working with students. Okay, what are your strengths? Let's name them. Let's identify them. Let's see how we can help you to understand them and then put those strengths into use so that you can leverage that and then find success in the things that you're doing. And when we can do those things, we see increases in academic achievement. We see increases in pro-social behavior, but importantly, we connect with the humanity and people. And therefore, for me, the strength-based approach is critical and essential to everything that we do, not only in schools, but the way how we parent, the way how we communicate with one another, and importantly, and how we make policy and decision-making. That sounded good, didn't it? I didn't write that.
I mean,
anything.
there's so much in there. That is awesome. I mean, I just,
it's the energy of this panel. You all are amazing.
So awesome. I saw David nodding vigorously during your presentation, Byron. So I'm just wondering, David, if you want to jump in there and talk a little bit about, both negative framing, especially for, let's be honest, especially for Black boys in schools and other systems, and sort of, what you have seen or the potential to turn that around in the way Byron was talking about.
I mean, Brian was definitely on point. He spoke to a lot of things, but the main thing he spoke to about the positivity. There is some positivity in everybody that we see. And like when he said that every time, like it brings back the thoughts of my grandson. My grandson was always getting the negative part. You're bad, you this and that. And it got to the point where he said, well, everybody else think I'm bad, so I'm bad. So I'm going to do what I do, And it's great because we need to start in the school system. And, like you said, it's not like punishment all the time. It's not like, well, why you act like that. It's like, how did you get like that? It's getting that personal development with teachers, not being clinicians, but can recognize that there's an issue with a child that needs to be addressed and stuff. But, and it's difficult. And I just want to say that, I sit on the Orange Board of Education in New Jersey, and I don't know why they let me do that, because as a father, as a grandfather, I bring my perspective to the board, especially when it comes to the emotional, social learning with our children. But thank you so much, Brian. I appreciate it.
Sarah, I saw you nodding your head also, and I know you have some experiences of, advocating for your own kids and lots of other kids in our systems. Do you want to jump in here with sort of how we can reframe and think about, work from the strengths of kids and families?
Yeah, I appreciate so much of what you were both saying. And I get excited talking about strength-based stuff because that was a shift for me. Personally, when I remember like really learning about that and looking at a situation where typically in a clinical hat, we would say, oh, here's all the things that are wrong with this family. And being challenged to look at that situation and say, well, what are all the things that are right with this family? And we have my daughter and I have as a part of our work together now, which was again part of our story, a transformative healing in our family. And they're actually one of our youth peer leaders and helped to implement a local youth organization called Youth Move. And we would ask, we would do some activities about strength-based and what are some of your strengths? And I just remember very vividly, that was very hard for many people because they hadn't been asked before or had ever really had anyone bring it to their attention. They'd heard so often about what was wrong with them. And so it really took a lot of time and us exploring this in different activities and discussions to start like really thinking about what are our strengths and what are our values that we bring. And, the kid that we look at is always causing trouble in the classroom or something like that. And well, maybe they're a really great advocate, or maybe they've got a really good sense of humor, or maybe they're really charismatic, or, how can we look at this differently and reframe it and use it as a strength? And I love that conversation. It gets me very excited because these thought patterns really follow us in our daily choices and can really change the trajectory of our lives once we can start to challenge them and learn some new thought patterns. So I really appreciate that. Thank you.
Really well said, Sarah. And I so appreciate you working with your kid, sort of working alongside your kid on, advocating. So I'm going to just steal Byron's tagline here. Byron talks so nice, has this great tagline in all the stuff that Byron has developed of, Byron, just jump in if I mess this up, like not what's wrong with kids, but what's strong about kids. So, I just really feel like that's amazing and inspiring and could guide all of our work. The first question I had to ask you was actually more about barriers, but I was just so inspired by Manny and Byron to start our discussion off with talking about strengths. Because I think it's so important. Manny or Tyler, I invite you to sort of jump in with anything you'd love to share about sort of a more strengths-based approach with your own kind of story or the story of your work with families and communities.
Yeah, if I could, is one of the things that we've tried to do both with our prevention program, our youth program, and with our system of care team that Utah has amazingly dedicated and hired a team just for our Paiute community. But we have a program and a philosophy. Culture is prevention, culture is treatment, culture is healing, and basing off of that identity, of who we are is important and critical, and there's something good, not something wrong, something good and great about who I am. And we have the medicine wheel philosophy, Masuk Eve in Paiute, that we teach to our youth and our families, especially those that have either drifted away or have had it yanked away, kind of beaten out of you. Culture is bad. You can't do that. And now it's, it's that medicine wheel of looking at the whole person, looking at, I'm happy to be alive. I'm happy to be who I am, and really, gravitating to that, and helping folks learn their language, learn their culture, and seeing if, hey, does that fit for me, or do I like something else? What resonates with me, and what is strong and good and healthy.
Really amazing. And just thinking about sort of how for some of like the kind of this medicine wheel and more holistic approach, that might have been something that it had been taken away from the communities from Indigenous people, but it's something that we could all benefit for. So kind of relearning about things that, that we were made to unlearn. Just really amazing way of thinking about it. I really appreciate that, Tyler. Manny, I just wanted you to be able to jump in about the kind of strength-based approaches before we move on.
Yeah, I just want to say I come from an immigrant community, and we're so used to hearing no all the time. Oh, you can't do this, you can't do that, you can't do this. And after a certain while, you get so sick and tired of hearing no that you just like had it. And there's lots of barriers within the community that I come from. There's like, there's a culture barrier, there's a language barrier, there's a financial barrier, there's intergenerational barriers. There's so much going on there. And that being said, like, I know we're about to talk about barriers next. So I just want to say that sort of, let's not make strength-based be a barrier, because oftentimes people are just looking for something to ride the wind on, because they have so many no's, so many people telling them no's in their life, in different parts of their life.
So important. And just throughout what you all said, just about sort of how we internalize negative messages about people who look like us or communities that we're associated with, and how that really can be impactful over time unless we disrupt some of those cycles. And I think related to that, just peeking at the chat, there's a lot of really there's a super helpful conversation going on in the chat. My friend C, who logged in from Hawaii, I see is putting in a lot of great information. Dee and my colleagues Victoria and Suki about sort of ACEs and the negative frame, and how we can kind of reframe some of that damaging information that could arise from that more deficit-based way of doing evaluation and assessment. And I just love what Suki just wrote about more than lip service being paid to something that's strength-based. It's supposed to have been one of the pillars of systems of care for the past 4 decades, but how can we really actualize that strength-based approach? How can we disrupt the cycle of negative messages that kids and families are enmeshed in our work together? So appreciate the advocacy of everyone on this panel. I do want to go ahead and talk a little bit about barriers to doing this work. And we heard about some of these barriers. We heard about sort of, I feel like what Byron was mentioning about a deficit's way of thinking about mental health, and especially that's embedded in the way that we evaluate kids and individuals for learning needs and behavioral health needs is one barrier that's a really important thing for us all to address. Sarah, I'm wondering if in your kind of family experiences and deep work in the behavioral health world, if there are other barriers that you'd like to talk about and that you sort of work against the grain of in your work with families.
Sure. And I am kind of my own best inspiration in a lot of ways. So I can speak to the barriers of engagement, I suppose, and working with families and youth, and being a mom of 4 myself. I was actually sharing a little bit in the breakout room, is that if this weren't my job, it would be very hard to get my time. And let alone if I had something I wanted to share, well, how do I know who wants to hear this? Where do I go? You know, there's a lot of effort that you're asking on my part to get this information from me too. And so, you know, it's, for me, so much of this is about the accessibility, the information. How do we hear from people, and how do we know people want to hear from us? And is it authentic? Who am I? Can you come to me? Basically, instead of just saying, here's a seat at the table, we want to hear what you think. And does that feel safe to me necessarily, to just show up with a bunch of, you know, important people, stakeholders and whatnot? Do I necessarily have the confidence and feel like I can show up in this place and just, you know, speak to the issues that I'm experiencing confidently? Because part of my condition is that I doubt myself and I invalidate my feelings. And so it took a lot of time for me to learn that advocacy. And so as part of my experience, that's something I'm very passionate about, reaching to other families and to encouraging them to learn how to self-advocate and sharing these opportunities. But, you know, having authentic relationships and representation in communities. And I mean, not like, let's be there, let's go to them, let's hear about their experiences, and let's organize in that space where they're comfortable and where those kind of candid conversations happen. But they're the ones that need to be heard the most. But maybe we don't necessarily feel like, you know, I don't know if I want to say all this stuff, you know, on a larger scale. So yeah, I would just say that how do we make sure that this is accessible and authentic, relationship based? That for me is how you're going to get me. A personal invitation, not mass emails. You know, I want to know that you see me and you care about what I think genuinely, and that what I'm going to say is going to make a difference to someone.
Really just amazing insights. And I also really appreciate you sharing with us that you had some own personal barriers in being able to sort of share what has been helpful, and, you know, as part of your own recovery, in kind of opening yourself up to authentic engagement at this level of programs and policies and systems. So I really appreciate this idea of, you know, authentically engaging with families and kids and youth, and kind of letting folks work on their own barriers to be able to kind of you know, allowing folks to engage in a way that you know, they feel safe, because this work, we're opening ourselves up in ways that make us all feel very vulnerable. So how can folks get the support for this to be a safe space to engage, and to be able to, you know, feel like they're making an authentic contribution?
If I could just you know, tie that up just a little bit, I'd say when I really spend more time thinking about this, it's a lot about why I'm so passionate about peer work, because I think that people who are best at engaging individuals are people who can relate the most. So whether that's, you know, from your own community representative, similar life experience, you know, I really believe in the value of peer advocates, and really just building that capacity there to help elevate that voice.
I think that's an amazing consideration about remembering peer advocacy and sort of peer support in this work. Tyler, I think you have some really some great insights to share about engaging with Indigenous communities as well, in authentic ways, so kind of to have that back and forth between influencing policies and systems and programs.
Sure, thank you, and Sarah, thank you. Very well said. You know, just that. You know, it's so critical to have somebody with you know, with lived experience that you can connect with and have input from. One of the you know, things, obviously, you know, coming from a program administrator side of things, looking at, you know, how do we engage, even as you know, an employee, as an administrator, we would get invited. Okay, we want all the tribes to come to Salt Lake City and have a meeting. We want your input. We want to hear what our native peoples have to say and need, and how can we serve you. Well, coming from Southwest Utah, that's a 4-hour drive each way for an hour meeting. Okay, now we have virtual meetings, so that makes it a little shorter, but it's still come to my table, come here, tell me what I can do for you. And we had some wonderful people at the state that said, you know what, we've been asking this for years, and we get a few, that'll come every once in a while and share, and it's not working. Let's change this up. And they made the rounds and came to the tribal communities, and wow, there's a long ways between, your, that community and that community. And how do you connect people, between your, 100 miles or more between communities? How do you do that? How can we do that as a state? And changed a lot of thinking. And it helped us as well, because we did some of the same things where we said, we've got 5 different counties that we work with and work with people. And we went around within our communities, had, some just very organic discussions with people, with our community members over food, because we love our food, to just have a discussion and say, how can we best meet the needs? And we'd had kids and elders and moms and dads and aunties and uncles talking together at a table to just say, you know what, would be really helpful for our youth if they could hear the stories from our elders. How can we make that happen? It'd be really helpful if we could incorporate language into this program or that program. And as we did that, it just started, most of the successful programs that we have going came from those discussions. And most of the, the good connections we have and partnerships we have with our state folks came from those visits. They came and asked us. They came to our table. We went to their table. We all participated and were included. And too often we're like, no, you're over there, I'm over here. Just tell me what you need and I'll try to get it for you. Let's get together. Let's have a talk. And as one of my colleagues like to say, let's go for coffee.
I really love the approaches you articulated. And I think, what I'm hearing in all of that is sort of the importance for program leaders and policymakers to go to the communities and go to the community members. And again, like Sarah's kind of advice, or kind of her idea of authenticity, as opposed to like what you just said, as opposed to people saying, so what do you need? And we'll get it for you. And expecting folks that we're trying to engage to come to us, to go to them, to break bread with them, so to speak. So I really think that's so important, and is also culturally laden for a lot of communities that we work with, including the folks that Tyler works with. So those are really wonderful stories about approaches. So we move from barriers, which to, again, like much more positively framed content about engagement and authentic engagement. I'm going to read out the whole question as we hear from the rest of our folks on engagement. So the question that we were thinking of is, what would make you engage or accept an invitation to sit down at the table and contribute to policy? And what would make you leave? Manny, do you mind answering that one for us next, please?
Yeah, so I think when I see someone sort of at the top of the agency who's working sort of just as hard as everyone else, not only just as hard, but is setting the example. I used to work with someone who they were director of the program. They were the big honcho, top cheese, and there was this person who was youth serve who was transitioning, was doing a gender transition, they were coming out to their parents in their house, and it was very difficult for them. And one of their parents was on board. The other parent was like, they were a hot mess. And this director asked the young adult, "Hey, would it be okay if I go with you to your house and maybe see if I can help calm the situation down a little bit?" Took time out of her time. She has like back-to-back meetings almost every day. You see her on the computer. She never leaves except for when she's engaging with the youth. So she goes off. She talks to the youth, and the youth found so much support that they just like gravitated to the program. They didn't want to leave the program, and just like they didn't want to leave, I'm like, "Can you be my boss forever?" Because I saw their intention. I saw that, that's what really matters. Like, you see the intention of someone to do good and to want to help, and you see that from leadership. You're like, okay, this is a place I can get down with.
Really, wonderful story of somebody in a leadership position sort of, coming in to directly help a kid who was navigating a really hard transition with family members, and for somebody, to come and accompany them on that journey is a really sort of amazing model for how we can approach this work. So thanks, Manny, for that. Byron, can you go ahead and speak to this quick question? I know that you've had the opportunity to participate in local policy making, and for both thinking about, how did you see an entree to participate on that level, on the policy level, from work in schools, and how do you see a way for some of the kids you've engaged with to have their voice represented at policy tables?
Yeah, absolutely. And I think I'm blending some of the questions, the way how you asked it to Manny. So I'll just answer the best way I can. And one of the things that I heard in how you asked Manny was, what would make you want to be at the table versus getting up and leaving? And what really was standing out to me was several sequences of experiences that kind of came a tradition while I was working in Southeast DC. And that tradition was incident would happen, a traumatic incident would happen. Reporters would come to the school. Certain politicians, council members would come to the school, and then the next day they would be gone. But the community is still grieving and reeling from whatever that incident was. And then there will always be one or two people who will be there day in, day out, sending their constituents, really concerned, really advocating. You could tell they cared deeply about those issues. And so when the political season came around and people would ask for help or, certain feedback, but where were you when we were telling you this is what we need? You were only here for certain photo ops and certain things. And so our students could see through that. As a person who worked deeply with students, we could see that as well. It wasn't authentic. They didn't care about the actual lived experiences of young people. They only wanted political gain from it. And that never sat well with me, with our students, with our young people. So to answer your question, it's imperative that people who care deeply about the lives of young people, about their experiences, to really understand when they invite you to the table, it's that much easier to say, hey, this is what we're going through, because we know that you're there for real reasons. They know that that person might be there and they actually might do something about it. They might use their stories to actually craft legislation and draft policies, and work with lobbyists to actually advocate on things that will actually be passed to benefit young people. And the last thing I'll say about that, one of the better examples, we had a council member who is near and dear to the Ward 8 community, who participated during our redesign process. Even before we were redesigning, he would go to basketball games, and so when he would come and say, hey, like, here's a policy that we're working on, what's some input from your students? Our students gladly participated and contributed because he had been there every step of the way. So those are things that are really critical to helping influence legislation, and really that's that collaborative process.
That's really awesome. And thanks for keeping me on point with the way that I'm supposed to ask these questions. I think that's right. Awesome. I think, no, I really like the connection between what you just shared about sort of policy partners that kind of stick around through the whole process, or just come when the cameras and the press are there, when there's something traumatic that happens to a school or a community. And it just really reminds me of what Maddie was saying about the person in a leadership position who, was in the work and had a commitment to kids being served, and such a commitment that they were, that they wanted to share a journey with a kid at home and go to their house and help facilitate. So kind of the level of commitment and the duration of commitment really stands out to me in both of your stories. I'm going to go ahead and as Byron was pointing out, the same way, the original question was, David, this is for you now. What would make you engage with or accept an invitation to sit down at the table, and what would make you leave?
Well, thanks, Pamela. You kind of know when people are real or not, to be point blank and stuff. You kind of know if they throwing smoke at you. I use the state, for example. The state and federal government is not used to information going up. They're used to dictating what should go down and how policies and procedures should be. New Jersey, for one, had self-reflection in building a trust relationship. About 4 or 5 years ago, the buzzword was family engagement, but they didn't really know what family engagement should look like and stuff. All they know is that I got this grant, I need a couple of parents at the table, and, I decided not to be a check mark. They have to realize, and I think they're coming to the point they do realize how impactful family voices are. So when I know someone is intentional and genuine, I will stick with them. I will fight for whatever is needed for our community, for our people, because I know they're genuine. But I also know if they're looking to get a check mark and see how many family they engage because the grant said you need to do 30 or 40 families, Well, there's a difference between involvement, and that's inviting me to the table that you already built 6 months ago, and asking me, what's going on, why this not working. Well, you built the table and you didn't ask me for my input. And it's about family engagement. When you invite me to the table that's not built yet, the room is not built yet, and you want my input, and because we're going to co-design, people want to feel respected, and they want to feel that they're important to this work and stuff. So me knowing that you are genuine and you invite me at the beginning, 9 times out of 10, I'm gonna stick with you until the end. We're gonna work through this. Excuse me. But you invite me 6 months after you build the table, then we're gonna have an issue. I don't think you're intentional or genuine. You just want a family there to say you had a family. Thank
Thanks
you.
so much.
No,
Thanks
thank
so
you.
much, David. And that reminds me of something that Suki was typing into the chat about sort of, it could be that we are paying lip service during implementation and checking off boxes. And David, you've said before that inviting a family is not checking a checkbox, like really, truly, authentically inviting a family in the way that Sarah, talked about from her own experience it's not a checkbox. It's so much deeper. It's so much more. It's a level of commitment that, it has to be a sustained effort to truly engage and center the voice of a family or a kid. I think I just want to pause for a moment here because I see so many good things in the chat box and on this issue of sort of what do we need to do to authentically engage with kids, youth, and families, and what would it take for you to come to a policy table, and why would you leave? I mean, C is putting such wonderful things into the chat box, and I know from other webinars that C has a lot of lived experience as a family member and a provider. So I just wanted to invite C to come off mute to see if you wanted to share anything about this question and this topic.
Oh my God, Pam, thank you so much. Could you repeat the question again?
Sure. So kind of what would it take for you to accept an invitation to come to a policy table as either a family member or a provider with lived experience? And why would why would you leave? What would make you leave a policy or programming table?
Well, first of all, I actually used to work at a public policy nonprofit that focused on early childhood education and care. So a lot of the things that I've been putting in the chat, and to all of you in the chat box, thank you so much for letting me, just have, broken the dam within the brain of sharing all of these things. But for me, as a parent, I go because I want to inspire parents to be their children's advocate. Because when I was at that nonprofit policy and advocacy organization, I was blessed to sit, like Tyler said, on different early childhood coalitions and work with them on big policy things that people at the state level were working on, but on their deeper community level. So what were the things that were important to them, like transition conferences, making sure our children were going into an early learning program of high quality, and then into kindergarten, ready to learn, ready to succeed. And what do those schools do to transition youth into kindergarten? So my whole thing is to, I'm at the point of my career where I feel I have enough experience professionally and personally to give back to our next generation, whether it be care providers or teachers or even parents, because I think one of the barriers for schools, just from my experience, to listen to parents is they unfortunately have the experiences of parents coming to them and yelling at them and telling them what they need to do, because parents are afraid. They don't think that they're going to be heard. So that's one of the things that I've been wanting schools to work with asking those open-ended questions, learning more about the families that they're working with, try to come from a place of cooperation and not aggression. So then that way their children can get the services that they need and they want, because that's also something that I've lived with, but that's for another day. So I'm just on a part in my life where it's like, it's time for me to not only keep learning, but to cooperate with my colleagues to make the next generation better. We have a saying in Hawaii where when you go to the beach, you always leave it better than when you found it. So for me, I try to have that be a guiding light for me. When I come into a situation, I try to leave it better than I found it. And I really firmly feel that the best way for us to do that is by equipping our families and our professionals to keep that torch burning bright and to keep it going forward.
Really lovely. Thank you so much for jumping in and sharing that, C. As always, you have all these wise words to contribute to our offerings here at NTAC, so we really appreciate it. We are wrapping up now the panel, and we're going to open it up in a few moments more broadly. I just wanted to put out one more question to panelists. And I want to start with Byron, if it's okay. So what would you want people in decision-making roles to know about working with you and your family? So what are some concrete strategies, thinking about your experience in systems? What would you want policymakers to know about you?
Yeah, for me, and when we had our discussion a little bit earlier, some things that really stood out was helping policymakers, decision makers to understand that students aren't data points, that their families aren't merely data points. So often we look at students in terms of statistics, of, we have to meet these numbers, we have to meet these metrics, and we're so much more than that. Our young people are so much more than that. Our families are so much more than that. And the way how we shift that is by telling the stories of our young people, of communities, helping them to be experts of crafting their narrative. And what that does is it allows people not to create a narrative for you. And what it also does is when you can craft your own narrative, then people can understand the needs a little bit deeper. They're a little bit more heartfelt. And when people can connect with the hearts of others, then I think at the core of good policy and good decision is people and doing what's in the best interest of people. And so I've told the panel, and I want to share with those who are listening that my twin, he's in policy and lobby and legislation. We have a lot of different conversations. And one of the things that he stresses is that when people get to the table, they often don't know what to ask for. And so while I stress the importance of storytelling, he also stresses the importance of knowing what to ask for. And I think this is where educators, where people like us, where we have the knowledge and experience, is to help those who have the story to be able to, as some have said, to not only just to be able to advocate, but to explicitly know what to ask for. And a quick story of how that looks in action is our young people, some incidents came up. And one of the things that we did is, okay, this has been happening historically. You have the power to change it through telling your story. Now we have the ears of people. What are you going to ask for in that moment?
Mhm.
And our people were very specific about what they wanted and what they needed. And one of those things was mental health first aid training. And as a result of that, the mayor, the chancellor provided our young people with mental health first aid training. So I think those are some very tangible things that can help people to get started.
Really awesome. And I know that my colleague from NTAC, Tanisha, is logged on here. I'm going to borrow one of Tanisha's really lovely, eloquent phrases about heart stories, because what Byron is talking about sounds to me like heart stories, but it's more than sort of going deep with your story. It's thinking about, how can you turn that heart story into what you need and what your family and community need. So it's kind of, and as practitioners or leaders in systems of care, how can we work on, work on and with families and kids who are crafting their own stories, and those stories are still unfolding, to sort of take it to the next level. And now, okay, you have a chance to tell your story. Now, what do you like? What would you say we need from your story to push this work forward, the systems of care work? Sarah, I know that especially with the experience of your kiddo and all the great work that they do with Youth Move, I think this is part of the work that systems of care and Youth Move has been able to do with engaging youth. Can you talk a little bit, can you elaborate a little bit about what do you want people in decision-making roles to know about working with you and your family, sort of drawing on the great experience of working with your kid also in Youth Move?
Thanks. Actually, Byron, I was just like, if I could just like stamp so much of what you just said, or there was so much of that, because what came to mind was like, ask me what my needs are, don't assume them. I am an individual, my family has very specific needs, and sometimes just coming in and saying, well, this is kind of our standard protocol of services and programs, and this is what we're going to do, and we're going to fix you right up. And that maybe that's not necessarily actually what's going on in my life, where I really, what I could have used. It's a lot of those services are very beneficial in programs, but for my personal family, a lot of them weren't, and we had to create our own path. And so empowering families to know what kinds of choices and options that they have, and that they have a voice and they have that choice in the process, and listening to what really is their fundamental need. Right, Byron, like you really said so much, and I'm just trying to like go back into it because I was just lighting up. Yeah, I'm sorry, I just completely paused at that, but just look at me as an individual, and don't assume that this kind of standard protocol is going to fit, because I want policymakers, I want decision makers, I want them to take it personal. I want to know, would this be good enough for your family? Would this be good enough for your child if this was your situation? And I want to pose that question back on them, because that is the severity that we're looking at. And it's very clearly a growing need that we've got to look at as a crisis in our country, and say that it's time for us to do something different here, and really just listen to the voices of our families. So
Really excellent reminders. Manny, how about you? What would you want people in decision-making roles to know about working with you and the kids that you serve and the youth that you serve?
I think it's interesting. I had this sociology professor that said, used to tell me, like, it doesn't matter until it's in your backyard. And I think oftentimes, maybe like a policy maker may hear a story of one individual during like a presentation or something and think like, oh, wow, you're amazing. Like you keep going. And it's like, nah, homie, like this is me. This is my cousin. This is my brother. This is my friend down the street. This is everyone that I know has been through some similar challenge. So why aren't you doing something? I'm not like an oddball. I'm not like the miracle child. This is something that we all go through coming from the communities that, the people like me come from. So why isn't there more support? Why isn't there more help?
Mhm.
And I don't know. Yeah.
No, that's really amazing. And we've talked a lot in this panel about the need for peer support. Sarah brought that up, and I think it's really super important in thinking about authentic engagement and how we can leverage our voices to impact policy and programming and changes. Right? We need to do something different. We've been doing this for a long time, and kids and families are still being harmed. So we need to do something different. Tyler, go ahead. Can you please answer that question of what would you want people, like kind of federal policymakers, people in policy making roles in states, to know about, the families that you work with? What are some concrete things you want them to know?
Absolutely. Don't know that I have much more to add. Everybody is, I love that, Sarah, don't put me in a box. I think the biggest thing is, and I'm hearing it from everybody else, I have a voice, I have a face, I have a home and a backyard, and I have neighbors and friends and family. Get to know my story. And if I am shy and don't, or not eloquent, like Byron said, get good at asking questions. Get good at picking out my story, learning my story, and helping me tell my story, or share what I need. Come to me. Come visit. Let's go for coffee. Let's break bread. Let's get to know each other. And I guess the other biggest thing would be meaningful change takes time. Don't be in a rush. Take time, plan it, and carry it out together as much as possible.
Absolutely. Meaningful change takes time. Learn how to ask questions, get really good at asking questions. David, I would love for you to go ahead and finish out our panel here today. We're almost at the end. Please.
Well, thank you again, Pam. And, thanks, Tyler and the panelists. All you guys have been great. And like I say, I'm probably not adding anything on it, but C said it very well in the chat. Nothing for me without me.
Mhm.
Ask me what I need. Don't tell me what I need. Ask me what I need. Have that conversation with me. And just real quick, I sitting on a couple of early childhood committees, I generated what I call the 4 E's of empowering parents and family leaders. 1, engage me on my level, not your level. Sometimes you got to come down and my level and kind of slowly bring me up and stuff. Educate me on the services of support that's out there, so I know what's out there and I could tell you if I need that or I need something different. Empower me to be a strong advocate for all children, not just my children, not just special needs, but all children and stuff. And encourage me to be a voice of change. We have to, as parents and families, have to realize that how impactful our voices are. A lot of these grants and stuff, you know, they come one year, they go in another year. But when I think of sustainability, I think about the parent's voice. If we're able to tell our story, articulate our story, and ask the right things, Brian, ask the right things, you know, we'll be able to sustain the services and support that we need. And those decisions are not coming always from the people that's in power and stuff. And a colleague of mine said, we're talking about shared power. We've been, excuse me, we've been talking about shared power for a long time. Let's talk about shifting power to the people. Thank you so much. I appreciate you guys.
Really lovely way to end it. And just thinking about if youth and family voice is one of the enduring things about our work beyond like limited programs and grant cycles. And all that you said about shared power and shared leadership. I'm going to go ahead. We only have a couple more minutes and turn it back to Suki. Thanks so much to the panelists. Really such a pleasure.
Yes, thank you all so much. I feel like I have learned so much from all of you, and I love really creating the opportunity in this space to invite folks with lived experience at so many different levels, whether you're a parent or a clinician, a psychologist like Byron. It really does take all kinds and all experiences and all voices to really make the most out of our system of care and how we work together. And I really value everyone on the panel today. And as I'm closing out, I want to invite our participants to drop into the chat just one thing, small, big, medium, whatever size works for you. Just drop in one note about a takeaway that you have from one of the stories that was shared. And so I'm gonna just share as a way to recap and summarize some of the things that I heard from the panelists today, as I invite everyone here to do the same in the chat. So I heard a real need to integrate strengths-based approaches. And I want to think about this for the folks on the call who we really want you to have something tangible that you can turn into a tip, a strategy, something that you can implement in your own communities, or even just a point of reflection that can help you kind of take the next step, or make the next best right decision for you and your community. So really had a strong focus on strengths-based approaches. We talked about the importance of meaningful engagement and not, lip service, really not saying engagement is a checkbox or just saying, we need, people at the table, but true engagement. And I think part of that engagement, especially we heard this from Sarah and Tyler, is going there. Don't assume that everyone is coming to your table. So when we talk about expanding our table or extending our table, that may involve us picking up and moving a chair or picking up or going to coffee like Tyler talked about, so going there, not assuming that the path to engagement is opening your door. It's about maybe leaving your door, leaving your office and going out into the community as part of that, the main point of that engagement. I also heard a little bit about kind of trust building and kind of following up and following through. If we are not, if part of that engagement, if we're not, we don't want to just drop in, like Byron's example about the folks coming into the schools after a tragedy, we don't want to just drop in and then leave. What are we doing? Or as C talked about from Hawaii, leaving a community or a place or a home, better than you left it. So we talked about the importance of storytelling and really supporting the people that are out there advocating, how as system administrators, policymakers, CEOs, whoever are making some of the decisions out there, how can we make sure that we're really supporting those voices, not just inviting them to the table, but actually supporting that full process and encouraging people to understand how, what to ask for. And part of that is around conversation. Really engaging. And I think that this wasn't said specifically, but I feel like it was sort of nuanced, is I feel like when we're building a system of care, every opportunity that we have with a young person a family maker, a family member, or even a policymaker, is every opportunity is an opportunity of every interaction is an opportunity for transformation, not just the transactional nature. The people that we work with are not data points. And so we really appreciate everybody's engagement. I know we're at time, so a couple of quick notes. Joanne will be following up with an evaluation. We really are happy that you were able to participate today and look forward to your feedback about this session and your engagement in future INTAC sessions. And then I would be remiss if I did not talk about, and I will post the registration link in the chat, we have a System of Care Summit coming up on May 10th for System of Care funded grantees through SAMHSA, and May 11th for everyone involved in the children's mental health field, and in those who are engaging in promoting the System of Care framework or just want to learn more about it. It's going to be an incredible day. We've got literally dozens of subject matter experts and people with lived experience who are going to be sharing their experiences about the System of Care framework and where are we going next. And so our theme is a journey together, redefining our approach for system of care. And this conversation is directly in line with what we're going to be talking about at length and in many different ways at the summit coming up. And I really hope that you can join us. Victoria or Pamela, anything else to add before we go? Okay. Well, thank you so much. I appreciate everyone joining together and having this conversation and listening deeply with our panelists. And I look forward to staying connected. And please do reach out to INTAC for any of your system of care or children's behavioral health needs.
Thanks, everyone. This is fantastic. It's been fantastic. I'm a lifelong learner, and I appreciate everyone.